Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is an overview of sacroiliac joint pain. Well, what exactly is the SI joint? Well, you have two of them, one on your right and one on your left, and basically they're also called the SI joints, and they exist where the pelvis meets up with the sacrum on both sides. And this is actually called the ilium part of the pelvis, and you have the sacrum, so you have the sacroiliac joint. As you can see, it's kind of an irregular joint. There are two of them. They are located, as I mentioned, where the pelvis meets up with the sacrum. They do have cartilage, just like other joints that are mobile, but they only have movement of about 2 to 4 millimeters, with physical activity. So because they have cartilage, degeneration can occur just like elsewhere. Studies show that 12 to 25% of low back pain actually comes from a problem in a person's SI joints. And the joint pain may lead to referred pain either in the low back, it could be in the buttock area, the hip, go down the leg, thigh a little bit. So the treatments for SI joint pain are by and large non-operative. There have not really been any operative treatments for SI joint pain with any muster that have research to back it up. Over-the-counter pain medications can be very helpful, such as non-steroidal anti-inflammatories like Advil, naproxen, which is Aleve. Tylenol can also be very helpful. Narcotic medications can be administered for exacerbations. They should not be prescribed long-term because then the risks start to outweigh the benefits. Physical therapy for sacroiliac joint-related pain can be great. It can include range of motion with active and passive activity, also ultrasound, electrical stimulation. Chiropractic treatment also overlaps with this, can help a lot as well. You have TENS units, which are what are shown here. It's just a little iPod-sized device with a battery, and then you have these foam pads that go on the skin over the area of pain, and tiny electrical impulses go through that and can help change the way that the brain perceives pain signals for pain relief. Interventional treatments for SI joint pain, there are quite a few. Trigger point injections, because the problem in the SI joint can lead to aching and cramping over the area in the low back or in the buttock, and trigger point injections can help mitigate those. An injection right into the SI joint, like this, can be extremely helpful. It should be done under fluoroscopy, which is a real-time form of X-ray. And the reason is that if you look at this joint, it's kind of jagged and irregular. It's not so easy to get into like a knee joint. There's a lot of soft tissue over it, so it really should be done with some kind of image guidance, whether it's ultrasound or fluoroscopy. Okay, and it's cortisone, just like is the gold standard for other joint injections, and that can help with pain relief for weeks to months. A lateral branch block is the same type of thing as what's called a medial branch block up in the lumbar spine, but the lateral branch block gives numbing medicine and steroid outside the joint in the area where the tiny little nerve endings laterally come in to supply sensation. Okay, so that can change the way the brain perceives pain signals and halt transmission, from those lateral branches. They don't do any motor activity. They just provide sensation to the joint. Okay, so if that works and then it wears off, a procedure called a radiofrequency ablation can be very helpful. And what this involves is providing thermal heat energy around the area of these lateral branches. You see these tiny little nerves here? Okay? Those are the lateral branches where the numbing medicine is given a lateral branch block, but here you're actually deadening those nerve endings with heat. Okay? Now this was looked at in a study in 2012, American Academy of Pain Medicine, and showed that over half of patients achieved at least 6 months of considerable pain relief with the radiofrequency procedure. And just like it's used up in the lumbar spine and also the neck, if the pain relief wears off, it can be repeated with the same excellent results being expected. So it's an outpatient procedure, it's low risk, and it's increasing in popularity. At Arizona Pain Specialists, there are multiple board-certified and award-winning pain management doctors that offer all these treatments, including pain management, chiropractic, physical therapy, and acupuncture. The pain doctors offer both medical and interventional treatments at 5 clinic locations, offering over 25 treatment options, and they take 50 insurance plans. Okay? The number to call for scheduling is 602-507-6550, and visit us on the web at ArizonaPainNetwork.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.